We have a visitor to the UAE coming, seeking medical tourism. He had a very big tumor in his right forearm. This tumor has been there for about 10 years. Unfortunately for this patient, he had repeated surgeries to remove that tumor, but unfortunately they were unsuccessful. He reported that he had 13 different surgical procedures over the course of 10 years, different skin grafts and different interventions, but all were unfortunate for him, and the tumor recurs several times over and over again. He visited our center in the UAE in Dubai, the Comprehensive Cancer Care Center, seeking our advice and surgical treatment for his tumor. As a multidisciplinary team that we adopt here in Mediclinic City Hospital, we started the basic investigations, the advanced one, and we completed what we known as a tumor workup procedure. Based on these information, we had a team decision that the best course of action is to give this patient a chance for resection of his tumor and do a reconstruction. The tumor is very extensive in the forearm. This is the forearm. It's massive. It's involving a lot of tissues and a lot of muscles. It's attached to the bone, and it is extensive, and it's considered to be a challenging case given the fact that this is his dominant hand. We needed to assess the vascularity and the ability to move his hand after resection.
So the key to today's procedure is essentially to perform a radical resection of this tumor whilst preserving all the nerves, arteries, veins and tendons supplying the hand. He's essentially going to lose most of the tissue between just below the elbow and the wrist area. And in order to reconstruct that, we're going to need to take what we call a free flap, which is a large piece of tissue which we're going to take from the thigh region. We call this an anterolateral thigh flap, or an ALT, based on an artery and a vein. And we need to then transplant that, much like a kidney transplant or a heart transplant. We need to reconnect the plumbing up in the arm here, so to the artery and the vein. And then this piece of tissue from the thigh will then live up on the arm. So that's the objective of today's procedure. It's going to require microsurgery, a lot of time, careful time and attention in removing this tumor, which I'll be doing with my esteemed colleague, Dr. Mashhour, who's leading on the case.
After we did the resection, now we're almost 3 weeks after resection of the tumor. The tumor was located in this area. We will, as you have seen in the pre-operative images, this is the location of the tumor here. We did an entire resection in the forearm from this area all around. It's completely, what we call it, we actually skeletonized the entire forearm in order to get the tumor out. We went deep into all the tissues inside and flushed with the bone, dissecting all the vascular, neurovascular bundle, the blood vessels supplying the forearm, the nerves, successfully isolating the tendons. We started with the tumor resection and isolation of all the soft tissues and dissecting the tumor from the forearm, safely removing it. It weighed about ½ kilogram in this forearm. And then the plastic surgery team went in and they had the vascularized flap, and that was made, and it is very successful. There is no swelling, there is no edema. The hand function is completely preserved.
So we've taken a piece of his thigh tissue and we've transplanted that up onto his arm by sewing the artery into his radial artery and the vein into the vein of the radial vessel in order to keep this piece of tissue alive. He's done extremely well. As you can see, the flap has survived in its entirety, and I'll just perfusion of the flap via the vessels that we've anastomosed in his forearm. So we managed to preserve all the tendons and all the nerves to his hand, which managed, in order to maintain complete function, remove the entirety of the tumor and reconstruct in one sitting. So he's done extremely well, and we're very happy with his progress.
Thank you for trusting us to take care of your arm and do the surgery for you. And we wish you all the best and safe return home to your country. Thank you very much.
Thank you.